I feel it's very, very important that we collect and have our own data here. CVS, Walgreens, they're very good for everything that they do, and they sell a wide variety of different things that make a lot of money, and the doctors have made them rich by writing out our prescriptions and sending our patients to the pharmacies. So now they also want to do testing, which takes some income out of our hands. We don't get a lot of money to do the testing, but we can do the blood draws. Many centers throughout Monroe County, we can do it. We can send the results to our Monroe County Department of Health, and we can track our own county. I don't need CVS, I don't need Walgreens to track our county in a national data bank of 200 million people and try to say, hey, could you send us our data? We need to know our data. We can send them our data, and we will get it quicker, and we will be able to act more efficiently if we take care of our own local communities.
Talk to me about your thoughts on the convenience factor. Like people see Walgreens and CVS as convenient. Oh, I can walk right in there and get it. What do you say to that?
People can walk right into advanced urgent care and get it. That's what I say to that.
And you're saying it's better for the
thank you.
And you're saying it's better for the community because the results stay here and the results are extrapolated quicker.
Yes, absolutely. We're putting together, through the Department of Health, a good coalition of multiple organizations and the hospitals that will be able to do the testing, compile it, and get it to our Monroe County Department of Health for analysis. We have statisticians available. I have personal statisticians that have volunteered to take the data, collate it for us at no charge. We need to stay ahead of the feds. Look, we need to test as much as we can, but we've been a community that's been self-reliant and self-supporting during every crisis and after every crisis. So we need to support our doctors. Our doctors from Key Largo to Key West are hurting. Our hospitals in Monroe County are hurting. They're not doing elective surgeries. So we need to keep everything we can here to help everybody rebuild over time. There's income that needs to stay here. It's not like giant amounts, but why should CVS be taking tests from us? Why should they be not only telling the community that their pharmacists will take care of their patients? It's not their patients. Are empowering pharmacists, and I love the pharmacists, but they're empowering them to be thought of as doctors or mid-level providers. They're not. We do complete histories, physical examinations. We do broad-based testing. We make recommendations. Who's going to be responsible? What are they going to tell the patient who comes back with a positive IgM and IgG? What are they going to tell them 6 days later or 3 days later? That person may be infected. Okay, so the question here is, can a person come to advanced urgent care and have an antibody test? Yes, they can. If they have no insurance, okay, we will see them, do a mini exam, and do the IgG, and we will become their doctor for that particular test. We will contact them when the results come back, and we will also let the Department of Health know that we did that. If it's a positive, what are we doing? We're working together. If somebody has insurance and they don't have a doctor, they can walk in and say, I would like to get an antibody test. So since they don't have a doctor's orders, one of our people will see them, do a quick examination, a mini exam, or ask them questions: fever, travel, nausea, vomiting, headache, cough, dry cough, and we will then become their doctor for this. So then we will order the test, do it right on site, and we will get back with them. We do not charge for the COVID test. Okay, we will put into their insurance a charge for the evaluation. Okay? The final scenario is a person has insurance and a doctor. The doctor wants an antibody test. The doctor merely writes, test antibodies for COVID-19 on a prescription blank, and we will do the test, and it's a $15 draw fee. Done. The doctor gets the results. The patient will get the results afterwards, and they can go through the process with their doctor.